Sport Manitoba has brought together 4 athletes ranging from the recreation to professional level, representing a variety of sports, each of whom shares their experience with concussions. We also spoke with Dr. Mike Ellis, who is the medical director of the concussion program at the Pan Am Clinic. Dr. Ellis provides us with the medical explanation and behind the scenes of concussion recovery. Our intention is that this video raises your awareness and provides accurate information about concussion injuries. Could you introduce yourself and tell us about your sport background?
My name is Cassidy Nichols, and I am a retired field hockey player. So I started playing sports at the age of 3, just about any sport you can imagine. Soccer, basketball, volleyball, hockey, lacrosse, really whatever I could try. And basketball was kind of my main sport in through high school. And then in grade 12, I chose to specialize in field hockey. So I played on the provincial team since I was 12 years old. And then I went off to York University in Toronto to play 5 years of field hockey there.
My name is Devin Chisholm. I grew up playing soccer for the most part of my life, probably when I was like 6 until into university. I stopped for 2 years. I was going to play this year, but because of our situation, our league is on hold. So yeah, I've been playing soccer about my whole life. I've played some rec volleyball, dodgeball, softball, a little bit of everything. I'm really open to any kind of sporting.
I'm Jordan Reeves, born in Winnipeg, raised in Winnipeg, went to school in Brandon actually, went to BU, played basketball there for 5 years. After I was done basketball at Brandon, I wanted to pursue professional basketball overseas. So I went to Europe. I was in Spain for a little bit. Then I went to Slovenia and then finished in France. So I came back to Winnipeg. My mom's neighbor at the time was Dimitri Skoros, and he was a kicker for Ottawa Renegades back in the day. And, I just, by fluke, was outside same time. We just got to talking, and he asked if I wanted to get back into football. Why didn't I? And I was like, yeah, let's give it a shot. I'm not doing anything. So from that, I got in contact with an agent. I got set up to go to the Edmonton Combine in 2015. And once I started playing football, I fell back in love with football. I was a football player growing up my whole life. When I was a kid, I stopped playing at 15 years old. But yeah, once I got back into football, I was playing from 2015 to the present right now, other than the season being cut this year. But yeah, so I started basketball and I made a switch about 5-6 years ago to football and loved it ever since.
So my name is Amber Vulcan. I'm from Winnipeg, Manitoba, Canada. I've been a race car driver for 18 years. I started in go-karts. I've raced everything from dirt sprint cars to NASCAR. I'm currently racing a dirt midget all over the US. I'm the first Canadian female to win a NASCAR race in the USA. Broke Canadian history in 2016. So it was exciting for a Canadian female to kind of step outside of what I guess is the norm and break some barriers here in the States.
So could you tell us a little bit about what your experience or multiple experiences have been with concussion injuries?
I've actually had a couple different concussions, both sport-related and non-sport related. So my most recent one was sustained in my 5th year of university field hockey. It was just in a practice. Me and my teammates were scrimmaging, and I got hit in the face with a stick right under my cheekbone. And at first I really didn't even notice any concussion symptoms setting in. Just felt a little uncomfortable, but I actually continued to play during practice, and it wasn't until about 3 or 4 hours after practice that I actually realized that I had sustained a concussion.
I've probably suffered about 4 to 5 concussions in my racing career. They've all been minor in the sense that I didn't end up in the hospital or there wasn't memory loss or anything like that. But recently, actually 2 months ago in July, was my first really bad crash. I rolled over multiple times, ended up in the hospital for 3 days, severe concussion. I didn't really remember anything of the accident. I don't remember how it happened. I just remember waking up to the paramedic crew all around me, and I was hanging on top of a fence. I was kind of in and out. Then I remember waking up again in the ambulance. I couldn't feel my legs or my arms. I thought I was paralyzed at that time, so it was a very scary moment. They shot me with adrenaline. My feeling came back in my legs, my arms, all my limbs, and but I still was very fuzzy. it was my most severe concussion. It was definitely scary, but that was 2 months ago now. I am healed up. I'm actually going back racing this weekend for the first time since the accident. So that's where I'm at now.
I was rollerblading at Birds Hill Park, and it was like my first time rollerblading. And I was really confident that I knew what I was doing. I can skate, so I was like, this is simple. This is no different. Got a little too confident. Was just reaching a hill, and I wasn't wearing a helmet, which is the first mistake for someone in a new area doing a new activity, especially rollerblading. I got going too fast, and then realized that I wasn't comfortable that fast, and then kind of panicked. Tried to hit the grass to kind of wipe out, but I didn't make it. I fell backwards, and first thing that hit the concrete was my head. So yeah, it was, in the instance, I didn't think anything of it, just that it hurt.
Most recent one for me would have been my first year playing football again. So I missed the whole high school, university, college days of football. So that was mostly like the fundamental and technical aspects of football. So when I jumped back into it, I was very raw. I didn't really have the techniques. So it was our second preseason game, and I was on kickoff return. And the technique for kickoff return is you want to draw back, and you don't want to look at the guy you're blocking right away. You want to look at a different man. And then right when that guy you're blocking comes through, you want to jump to him. Well, I was so excited just to be out on the field. It's my first time playing CFL. I sprinted back to that spot, and I just stared at my guy for about 15 yards. And I knew I messed up because he locked eyes with me. And it was a big boy. He was probably a little bit bigger than me, so I'd say about 250 pounds. My height, 6'4". And I just remember at that moment, I was like, you either back down from this guy and probably get cut, or you stand up and handle your business. And I just remember bracing myself, and he didn't stop moving one bit, and we went helmet to helmet. And I just remember bouncing back, and I couldn't hear anything, just that ringing. And I remember that ringing sound. But this time I saw nothing but white spots everywhere I looked. If I looked to the left, there was just white spots. I looked everywhere, white spots. I was disoriented. And my first year, I was actually a receiver. So after the kickoff return, I was on the field right away. And I remember I heard a whistle, and I started walking to the sidelines. I was actually walking towards their bench. And one of my teammates said, "Jordan, we're on offense, let's go." And I just kind of remember turning around and getting back to the huddle, listening to the play, getting to the sidelines, and the next play was a throw to me. And I just remember catching the ball and dropping to the ground because I had no idea what was going on. We got to the sideline, they asked me if I'm good, and I was like, yeah, no, I'm good. This is my first year trying out for the CFL without a football background. So in my mind, injuries are secondary. They mean nothing right now. Make this team do whatever you have to do to get back on that field. Absolute wrong way to do it. 100% do not encourage anybody to do that.
What symptoms did you experience early on? What was it that made you think, okay, maybe something happened here?
My main symptoms right away, right off the hop, were headaches, nausea, and feeling off. I think that's one of the biggest ones they often talk about in concussions, and it's just you don't really feel right. You're not exactly sure what it is, but I felt off. I didn't feel like myself. And one of the things I initially thought was maybe I'm coming down with a flu or something, because it just felt a little bit off. I wasn't very hungry, and I was really, really fatigued. So I thought it might be the flu. I wasn't totally sure because I didn't have those symptoms right after my concussion.
Definitely remember how I just saw spots. The noise was just distorted right away, and anybody talking kind of felt like they're screaming. And it was just kind of like I wanted everyone just to calm down. But yeah, it was concussion is definitely a scary subject and a scary thing to go through for sure.
Definitely felt lightheaded, but I kind of got off. There's people really like running by me or spiking by me, so my ego was a little bruised. So I think I just wanted to get up and keep going and brush it off. So I did that. I only made it down the hill and around the corner, and then I started getting so dizzy and nauseous. And when people say you see stars or you see birdies, in some situations I can definitely agree with that, because I definitely was was seeing stars. So I immediately was like, I'm not okay. I sat down and took my blades off, and then we walked back to the car. So yeah, the immediate symptoms were definitely there. I definitely maybe tried to ignore them after it initially happened, but once it set in, it was serious.
And so that delay between the initial accident or incident and the concussion symptoms was longer than you were maybe expecting. You mentioned you had previous concussions. Was that experience similar or quite different in this case?
Actually quite different in my most recent concussion. I think like a lot of people, I thought right away I'd be able to tell that I had a concussion, and lots of times people think, you're knocked unconscious or you're seeing stars and that sort of thing, and I had that expectation. So in this most recent concussion, it was very different, and I didn't think I was hit hard enough, and I also got hit in the face, not the head, like directly in the head. So it was very different than my other concussions, and I think that's what was so confusing for me. It wasn't like a typical concussion like you would expect.
The previous concussions that I experienced were a little bit more mild in the sense that my bell was definitely rang. I lost consciousness for a few minutes, but when I woke up, I felt very fuzzy, not quite all there, but gradually felt better. I would say there was one that was a little bit more severe in particular, where I did kind of lose my vision for a little bit afterwards. And with all of those scenarios, I just made sure I had really good rest that night. I had someone kind of looking after me, checking in on me to make sure that I would wake up afterwards. And it usually resulted in just a really, really sore neck, just fatigue. But within the next day or two, I felt quite a lot better. This one was different in the way that it was a severe concussion. I didn't feel like me for, I would say, quite a few weeks. I was on pain meds and everything as well, because there were other injuries besides just the concussion. But this last concussion was the one that hit me the most, just in the way that I experienced a lot of the symptoms like nauseousness and not feeling like myself. I felt very agitated. I felt like I wanted to snap really quick, which is not my personality typically. And it took a while to kind of work through it.
And then at what point did you go see a doctor or have it checked out? How did you decide that you thought you should do that?
So for this one, I've had multiple concussions. This was kind of my first one where I didn't know a lot about them. So this one I didn't really reach out. But my second concussion that I got was similar in like the symptoms and everything, a little worse. But when I did reach out, it was the morning after. And I was like, I don't feel good. Like I went and tried to shower, and like I was just super dizzy and like lightheaded. I tried to go down the stairs, and like totally like everything in front of me was just blurred. And I was just like, this is not normal. And my mom, I could just hear in the back, and it was weird. It was like tunnel vision. Like everything in front, I was just like so focused on trying to like make it down the stairs. I remember hearing my mom in the background being like, Deb, like what's wrong? And like she just noticed that something was up, and like I just went and like laid on my bed, and like I could just hear her like running down after me, and I was just like laying there in the dark, and she's like, what is up? And I was like, I hit my head, and like I don't feel good. So like we went to the doctor, and
I actually tried to go back to practice the next day and thought maybe I do just have a flu. We'll just kind of step on the field and see what it's like. And after about 5 minutes, I realized, no, this is definitely a concussion. This isn't safe. So I removed myself from play, and I self-reported concussion symptoms to our team athletic therapist, who then referred me to our team doctor.
Can you speak a little bit to the concussion testing? Was there much of a testing process after this time, or in your previous injuries as well?
So with racing, and especially dirt track racing, which I'm doing currently, they're still really in the mindset of kind of like the good old boys club, and there has not been a lot of progression as far as concussion testing, concussion prevention. There's no real protocols. The baseline test I didn't even know about until Jordan told me about it. So even though race car drivers are athletes, a lot of drivers are still set in that mindset of back in the day, like, oh, just put a washcloth on it, you'll be okay. And they don't have the knowledge or the I guess information to understand how serious this is. Like if I could make the protocols, I would say that every single race car driver before they step in a car starts with the concussion protocol and concussion test. And because I've still never had a concussion test, which is insane that I've been racing for 18 years. And so that's something I would like to work on with different series to make that, you know, if not mandatory, but at least talk about it and open the conversation about it, because it is serious. And even though we're not football players going head to head with each other every single play, the chances of us rolling over, hitting the wall hard, getting concussions is obviously very high. Considering I've had, 5 in the last 18 years. So I'm glad that we're talking about it today, and I hope that I can continue to talk about it with racers and open it up more, because there's lots to talk about with it.
Like, I know for sports injuries, they do a lot more testing. He took my blood pressure, got me to have my eyes follow his finger kind of testing. And you could just tell the reaction time in my eyes was just not there. And then just all the questions about how I was physically feeling and how my head was feeling. Especially being someone, I never get headaches and I never get dizzy or anything. So he was like, clearly you are concussed. The severity of it is what you'll kind of find out going through the rehabilitation process. But yeah, it was pretty straightforward. He was pretty he's like, yeah, take this seriously, because you're not okay.
Interesting, to say the least. I think it was quite overwhelming for me, just with all the different tests. You're already so fatigued and exhausted, you don't feel good, and it's going into a doctor's office, which usually has bright lights, lots of different noises, and lots of different cognitive testing. So for me, it was very overwhelming, and it was almost like I needed someone to drop me off and pick me up from the appointment, because I really couldn't do it on my own. So I needed lots of support. And it's great, all that testing that it's being done, and the cognitive tests are there and available for us, but it was very difficult for me to go through. For me, a lot of the cognitive testing was little word games, asking me to recite a series of numbers backwards. So they would read it forwards and I'd have to read it backwards, or remembering words throughout the session. And then as I progressed in my concussion recovery, it was also including some aerobic exercise. So biking. While I'm biking, I have to hold a conversation. I have to answer math problems, things like that.
Baseline test before every player does it before the season, usually in training camp. And what it is, it just checks where your brain is at when you're healthy. So they'll ask you a list of, I think, 10 words. It'll be like house, knife, ice, dry, stuff like that. You'll have to repeat it then. You have to repeat it halfway through, and then you'll have to repeat it right at the end. There's a series of squiggles and shapes that will either be straight up, rotated to the left, upside down, rotated to the right. You have to remember which way they're rotated and the sequence you get them. They'll list off a list of 3, 4, 5, 6 numbers. You have to say them backwards to them. What else is there? There's color test, hand-eye test, where, right hand L, left hand S. When you see blue, press S. When you see red, press L. A lot of that stuff. Overall memory stuff, say all the months backwards, say weeks backwards, just stuff like that. And so basically what it does is it gathers the information, so it can show you what you can do when your brain's healthy, right? So I'm 100%, this is how fast I could go through this is how much I remember. So when I do get that concussion, and it is a very tough test to just basically do it when you're healthy. It is tough to remember all that stuff, but when they give you 8 numbers and say it backwards, come on. After about 3 or 4 years, I understand why they're challenging, because when you get that concussion and you're trying to use your brain, it's going to stop on you. It's going to lock up. So they can see, well, Jordan got through the color test in 15 seconds healthy and 21 seconds off a concussion. So I don't think we're back to healthy yet. And it's a great way to keep revisiting, every week. Let's revisit, see where you're at every week. And then once you get back to your original state, now your brain's healthy enough to go back. So I think baseline test is something that should be implemented high school, college, pro level, amateur, every athlete should be doing a baseline test before they go into their season.
What has been your experience with the mental health side of your concussion injury?
I think the mental health portion is really important to talk about with concussions, and I think oftentimes we miss it. Just dealing with that injury. So whether it is an acute concussion where you're off to the sidelines, it sucks. You're an athlete, especially for those who are really competitive or have been training kind of their whole life. Like for me, it was always my dream to go away and play field hockey at university. It was always my dream to be on that provincial stage where we were competing for an OUA gold medal. So for them just you have to sit off to the side, that's really hard to deal with, like emotionally and mentally. And then there's also the aspect of, your brain is injured. Lots of times there are anxiety symptoms that come up. There's depression, stuff like that, because your brain's not working the way it's supposed to be. So I think it's really important that we support athletes no matter what they need, if it's the physical testing, if it's just someone to talk to, whatever it is. But it's important not to forget about that mental health piece.
The mental side has been really tough, especially when you're an athlete. The majority of the time, the sport that you're doing is everything to you. You live and breathe for that. You train for that. Everything is for that sport. And when that's all of a sudden taken away from you, it can be really, really difficult. Previous to my concussion, I had a few years where I didn't have the sponsorship I needed to keep racing, which left me more time than I wanted out of the seat. So that kind of prepared me for what it's like to not be doing what I love. So that kind of helped me in this scenario, but you really just got to keep as positive you can and focus on getting your body better, because if your body and brain isn't 100%, then you're not going to be the 100% athlete that you need. And excuse my language, but you can't half-ass that kind of stuff. You really have to make sure you're 100%, or else you're not going to have that longevity in the career, and you're not going to perform to your ultimate ability either.
Would you say that your concussion changed the way you played on the field at that point and now, if you've participated in recreation sports?
I don't think it necessarily changed the way I played. Maybe I'd be a little more cautious. I think once I step on the field, though, you kind of have that competitive instinct that just takes over. And so I really don't think it's changed that way, but I would definitely wear more protective gear. So in field hockey, a mouth guard they're recommended, kind of mandatory, but most players don't play with them. They just choose not to. So for me now, I know that's one thing I'm always going to have in, just because of concussions, for safety, things like that. If I'm going for a bike ride, I'm going to put a helmet on. I just take more precautions ahead of time because I know I'm competitive and there's really no way to stop a concussion.
I mean, I've been playing softball the past few summers, which is really low impact. There's no really contact. So that one definitely didn't hold back from that. It was also my first time ever playing these last 2 summers. So yeah, softball was fun. I didn't really think of anything of it. I also kickbox. That's like my workout that I do now. And there's sometimes where I'm like, I don't know if I want to do that, or like there's some like jumping and spinning, like round kicks. I'm like, if I fall, what's going to happen? I'm really cautious with like anything that involves my neck and head now. We did a dance, I'm in kinesiology, so we did a kin games dance for our conference, and they want us to learn cartwheels, and I was like, there's no way I'm going upside down. Like, I can't. I think I've always been cautious with anything to do with my head, because I'm just like fearful, but after that it's just set to me that I'm like, there's no way I want to injure myself again like that. It's not worth it. I'm
at the point where if I'm running down the sideline and I see someone barreling head forward on me, well, I'm not going to go head to head with him, right? I'm going to be smart, use my body to get him down, or use my body to block them, rather than just blindly throw my weight in front of them and try to just use strength. Moving forward, I'm for sure more cautious about the new equipment that we use for concussions. There's that new Q ring that we've been using around our neck. I've heard a lot of great studies on that. Adam Big Hill uses it for Winnipeg. Charleston Hughes for Sask. Chad Jeter, a bunch of the guys on my team, and I hear great things about it. It's supposed to help. I'm not a scientist, but it's supposed to help somehow with the brain moving. Helmets are getting better every other year. They're coming out with new technology for the helmets to help keep that brain in place a little better. So I would say the older I get, I'm just more cautious about my overall health and my overall, my overall brain health and whatnot. So if I, like, let's say if we're playing right now, I got a concussion, it would more likely be a talk of, well, are we continuing career or what do we do, rather than I need to get back next week. It's like, you know what, is it worth it at this point? Do I want to have dementia in 20 years to make a paycheck right now? There are other ways, but I definitely am more cautious about my overall brain health and body health for sure.
Thinking back now, before you experienced your first concussion, what was your feeling about concussions? Did you know about them? Did you know the symptoms?
Fairly educated on concussions. Just being a university athlete, we do take a little course before every season. It's mandatory for all the athletes in Ontario. So I thought I knew a lot about concussions. I knew about the return to play protocol. I thought I knew what the signs and symptoms looked like, but once I actually sustained a concussion and went through it, it was clear to me that lots of people have no clue what a concussion looks like, what the effects of a concussion are. Everyone just thinks it's going to be the same across the board for all athletes, and it really looks different in each player and each person. So I think I thought I knew a lot and I was fairly well educated, but by no means did I know everything about concussions.
I didn't know anything, to be honest. I mean, when I was younger, I was in gymnastics, cheerleading, volleyball, horseback riding, dance. Like I did a lot of other things as well. Never had any concussions in any of those sports, only with racing. And again, like I've learned so much just in these last 2 months about concussions that I should have known before. Like as an athlete, we should know these things. And it's crazy that we're not taught them. A lot of it is self-taught, but the one good positive about it is now I know more, so I can share more information about it.
So from the time you were diagnosed, what was the recovery process like? What did you go through?
First, I know like there's a lot of people that are like, don't sleep, make sure you stay up and all that. I definitely was fearing sleeping just from all of the talk of that. I'm still not 100% sure if that's like scientifically proven that you shouldn't sleep more or as much as you used to. But I definitely, the first day and after being diagnosed, I went home and just kind of relaxed. Tried to stay off of any kind of phones, computers, TVs, just kind of laid in my room in the dark. But yeah, it's like laying down was like, the room was always spinning for like the first day at least. So it was kind of hard to do that. And I definitely remember just laying there and being like, this sucks. I don't want to lay here and feel like this. But after the first day of kind of just relaxing, I felt a lot better the next day. Still like headache and any kind of fast movements, I get like dizzy, or it's kind of like when you've been sitting down for a long time and like you get up and you're like, oh, I'm a little bit dizzy. It was like that all the time for the first few days. And then after, just a lot of just doing minimal screen time and relaxing, not exerting myself too much for at least 2 weeks. And then when I did go back into the gym, it was starting off lighter. I didn't really do any running or anything. That was a lot of like bouncing because I definitely would feel not a headache, but definitely like some pressure if I was doing any bouncing. So kind of started light and lots of floor work.
Me, my recovery's been a little bit different than I think a typical concussion. So it took me about a month to get back to return to play, and I was cleared by the medical doctor and my team athletic therapist through the different stages of return to play protocol. And I actually did go back to play, and I played my final games as a York University Lion. But after a couple of my last games, I started noticing that concussion symptoms were returning. So for me, I was a graduating player, and we were coming up to the championship game. So I ended up playing through a couple different concussion symptoms and kind of just ignoring them, knowing that I'd want to be on the field when my team won the championship. And it wasn't until after field hockey was done that I actually recognized that I was going through what they call post-concussion syndrome. So I'm 3 years out from my last concussion, and I'm still suffering from lots of different symptoms, like day to day. So my concussion recovery has not been linear at all. It's kind of been all over the place. I have good months, I have good days, I have bad weeks. It kind of just depends what I'm doing and what my schedule is like.
Recovering requires a lot of downtime and a lot of, restoring your brain, restoring everything that was hurt in the crash or in the injury. So the biggest difficulty for me was just having that downtime and not always being on my phone and doing emails and doing this and doing that, not going to the gym. It's not only physically difficult, but it's mentally difficult too. And that's where, if you are suffering from a concussion, I really recommend audiobooks. So that way you're not having to read. You can just listen. That's how I listened to Dale Jr.'s book. And again, just reiterating that he wasn't truthful and he didn't communicate all of the things that he was experiencing through his first couple concussions, and it got way worse and way worse and way worse, and it ultimately ended his career. So it just goes to show for the younger people, make sure you take every single concussion very seriously. It's really about finding that balance of relaxing, knowing that you need your body to heal, but then also kind of transitioning to getting back to that normal life. So for me, it was like getting in just a regular vehicle and driving to the grocery store because I need to make sure my eyes are used to driving a car again. I'm not getting nauseous when I get behind the wheel. And so you want to rest and relax, but you also want to start slowly preparing your body to go back into what it was doing before. And before I got in the wreck, I did do concussion prevention in the way that I train. So for a big thing for race car drivers, super similar with football players too, is training your neck with weights and everything to make sure that if you do hit head on, you kind of already have that strength there. So training in the gym's huge, and then just kind of getting back to normalish life, I guess.
Thinking about that back to yourself as a high school student and an athlete early in your career, what would you, knowing now, having gone through that experience, what would you say to yourself at that time?
Definitely take my own health seriously, and to notice that something that is happening in my body that doesn't normally happen, to always ask questions and get it looked at, or ask questions to a professional. Like my first run, I didn't really seek a lot of help, just kind of was like self-diagnosing. I was like, yeah, I definitely have a concussion, which after getting my second concussion diagnosed and talking with a doctor about my first one, he was like, yeah, like it wasn't smart for you to avoid it. But that happens. Like athletes do it all the time. They just kind of avoid their side effects and avoid the headache and just kind of play through it, which is in long term not going to help you mentally or physically.
I think my advice would be like always have open communication with your coaches. For me, it's my crew chief, my team owner. One book that really helped me through my concussion was Dale Earnhardt Jr.'s book about concussions, especially for me as a race car driver, to hear someone else that was in the same profession of me talk about it. And he also really hit the hammer on the nail when talking about how no drivers know about this. No drivers are aware of concussion prevention, aware of concussion aftercare. And so his biggest point in that book was him not communicating with his coaches or his crew chief and the team to let them know how he was feeling. And what I think athletes need to know in general is the more you put that off, the worse you're going to get. So being open about that communication of how you're feeling and being truthful about your concussions is only going to help you in the long term, and it's only going to help you progress. So as soon as you don't feel like yourself, as soon as you know you've suffered a concussion, or maybe even just think you suffered a concussion, talk to your coaches, talk to the athletic directors, talk to nurses, doctors about what you're going through, exactly everything that you're feeling. Don't leave out details, because the more you're open and communicative about this, the better result you're going to have in the long run. You could go, because if you don't talk about it and it gets worse and worse, your career could be done as an athlete. But if you keep that communication open and make sure everything's getting fixed right away, then you can have longevity in your career, which I think most athletes want.
And is there anything else that you'd like to share, or that you wish you had known before all this happened, that that you'd like to talk about?
Wear your helmet, wear the proper size helmet. If you don't know if your helmet's fitting right, ask. I mean, if you're not feeling normal, even if it's a slight hit, just to ask questions and to reach out. Lots of teams do have athletic therapists. They're all trained in concussion protocol. So yeah, they're there for a reason. So always ask the questions that you need. They're not gonna get mad at you if you need to sit out a game or take some time off. Your health comes first.
I'd like everyone to know that concussions aren't they're not like a regular injury. So it's not like a sprained ankle where you can just tape up your ankle and continue to play on. It's really serious. It's your brain. You need your brain. It's not like we can go do anything about it once you have those concussion symptoms. So it's really, really important that we kind of create and foster an environment where athletes aren't afraid to report concussion symptoms. It's really, really difficult to stand up and self-report, and that's really the only way concussions can be taken seriously, if athletes report their symptoms. So we need to respect that and support the athletes when they do come forward and realize it's not a fun thing, it's not easy. It takes a really big mental and physical toll on an athlete to pull themselves out of the game. So we need to create that environment that it's safe and we're welcoming, we're making sure we're taking care of head injuries.
I think just don't take this stuff lightly, take it seriously. If you want to have a long, great career, be open and communicative about what you're feeling, what you're experiencing to those around you, because if they don't know what's going on with you, they can't help you.
Age that you have one of these. It's not like a cut, it's not like a broken bone. You can't fix that. You can't go get surgery to mend that bone back. You can't stitch up your skin that you cut. It's a brain, and once that's fried, it's done. So take care of that, because you don't want to be old, forgetting your child's name, forgetting your grandkids' names, forgetting your wife, who she is, forgetting your husband, who he is. It's the most important thing in your body. So you got to take care of that. You have to take care of your brain. So any coach, any parent, any other athlete that's been through it is talking about concussions, listen to what they're saying and take it in, because it's a serious, serious topic.
Could you tell us a little bit about yourself, your sport background, your medical background, and what brings you to us?
Hi, thanks for having me. I'm a neurosurgeon here in the University of Manitoba, and I serve as the medical director of the Pan Am Concussion Program, which is a multidisciplinary clinical program that takes care of children and adults with concussions and traumatic brain injury.
To get us started, could you tell us what exactly is a concussion?
So a concussion is a form of traumatic brain injury where there are abnormal forces that are transmitted to the brain, and it's a type of injury that's not associated with structural or physical injury to the brain that we would see on CT scans or MRIs, but it can lead to some temporary changes in the way the brain functions.
There's a difference between the symptoms of a concussion and the signs of a concussion. So could you tell us first what the difference is between the two, and then what the signs are and what the symptoms are?
Yeah, so a symptom is sort of how a person feels after they're injured, whereas a sign kind of describes how they act or how they look after they've had their injury. And so the most common symptoms that we see after a concussion are things like headaches, dizziness, sensitivity to light and sound, fatigue, difficulty with memory and concentration. But some patients will exhibit some more subtle symptoms, such as trouble sleeping or changes in their mood, such as feeling more sad or anxious or irritable than normal. And some athletes that are exposed to head and neck trauma in the context of sport can also exhibit symptoms such as numbness or weakness in their arms and legs, double vision, or neck pain that can in some ways signify a more serious brain or spine injury. The most common signs that we see are when athletes sustain a head injury and they're lying motionless on the playing field, or they're slow to get up, if they have any trauma to their head or they're clutching their head. So those are sort of common signs and symptoms that we would see in athletes that have had a concussion.
And if I were an athlete still participating in my sport at whichever level, what do I need to know about concussions?
In this day and age, I think it's really important that athletes are aware of the signs and symptoms of a concussion, how those injuries can take place in the sport that they're playing. they need to understand how important it is that if they suspect they may have sustained a concussion, that they remove themselves from play and they talk to either their coach or their parent or a trainer. And it's important for them to understand that they need to have a medical assessment and obtain medical clearance before returning to sports. And they also need to understand the consequences of not reporting these injuries when they occur, such as having a risk of having another injury that could either lead to worsening symptoms, more prolonged symptoms, or in rare cases, more fatal or catastrophic brain injuries. And the good news is that all of this information is really available in the preseason education sheets that are that form or are part of our sport-specific concussion protocols we have in Manitoba.
So, as a coach, what should I be looking for in an athlete that I suspect may have had a concussion, or when it had a situation that a concussion could have occurred?
Yeah, I think it's important that coaches receive similar education to athletes. It's also important that the coaches understand the sport-specific concussion protocol that either applies to their school or the sport that they're coaching. And it's important that coaches create an environment or a culture where athletes feel comfortable disclosing those injuries and taking the time that they need to recover from those injuries.
Is there a typical period of time for a return to play?
Yeah, so most child and adolescent athletes will make a complete recovery and a return to school and sports within about 1 to 4 weeks, whereas adults who sustain sport-related concussions typically will recover within 1 to 2 weeks. And there is a smaller population of patients or percentage of patients that can develop persistent symptoms, and sometimes they'll benefit from referral to a multidisciplinary concussion clinic or programs.
What are those steps needed to return before an athlete can return to their sport?
In general, that process involves taking a short time to rest from physical and cognitive activities, and then making a gradual return to school and sport-related activities. And in order for us to medically clear someone to return to sports, they need to be asymptomatic or have returned to their pre-injury neurological status. They need to be able to tolerate school full-time or work full-time as it applies. They need to have a full normal physical exam, and then they need to be able to kind of gradually go through those steps of their sport-specific concussion protocol.
What steps have been taken in Manitoba to optimize concussion education and care? I know you mentioned a couple of the protocols.
Yeah, so in my opinion, Manitoba is a national leader in concussion policy and care. Several years ago, under the leadership of Sport Manitoba, we just developed the Manitoba Concussion Working Group that included representatives from Sport Manitoba, health, education, government. And then what we did is we used the important work that went on with the Canadian Concussion Harmonization Project to develop harmonized protocols here in Manitoba. So now if you look on many of the provincial sport organization websites, they have a concussion landing page that provides education to their stakeholders on concussion, and then they have a sport-specific concussion protocol. And now if you look at the work that's been done with a lot of the school divisions, you'll also see that they also have harmonized concussion protocols that apply to their schools and their school divisions. And if you're going to create an environment where you're optimizing education and recognition of concussion, it's important that those athletes and patients have a place to go to receive care. And 7 years ago, our provincial government began funding a multidisciplinary pediatric concussion program here at Pan Am Clinic that provides timely access to care for children with concussions and traumatic brain injuries. And more recently, we've developed the Manitoba Adult Concussion Network, which ensures that adults will receive a high standard of evidence-based care. So in Manitoba, we don't always like to wave our flag about the great things we're doing, but overall, I think we've done an excellent job addressing this issue.
So, Dr. Ellis, as a parent, what should we look for in our children, or even our friends of our children, if we suspect they may have experienced a concussion?
Yeah, I think similar to athletes and coaches, it's really important that parents have some background information on concussion. Again, this is included in the preseason concussion education sheet that we encourage athletes and their parents to review before every season. And again, knowing what the signs and symptoms are of a concussion, knowing how important it is to seek medical attention if your child is suspected of having a concussion is important. We know that there's certain times of the year, like playoffs and things like that, where we're excited about playing and getting back to sports and things like this. But at the end of the day, all of our kids are going to need their brains for other things beyond their sports career. So it's just important just to make sure everyone's on the same page, and again, create that environment where children feel open to communicate and disclose their injuries and take the time they need to recover.
And so if I'm an athlete in, let's say, Russell, Manitoba, and I have an accident that concussion may have resulted from. What is the process for my medical care? Where do I go? Who do I report to?
Yeah, and sometimes in certain factors it does impact the time of day and things like that on the weekends or during the week. But in general, athletes who have a suspected concussion that live in a rural area should seek medical attention either at the nearest hospital, emergency department, or with their primary care provider. Not all patients or children that have concussions need to be referred to our clinic, but if the patient can arrange follow-up or the primary care provider doesn't feel comfortable managing that patient, then they can send a referral to our clinic, and we can either arrange to see the patient in person, or we have a pediatric telemedicine program where we're able to evaluate those patients through in-person video conferencing, and then decide whether or not their care can be conducted remotely, or whether or not we have to transfer them to Winnipeg for in-person assessments and other investigations.
In your experience, or with your patients and athletes that you treat and see, do the majority of them, are they able to return to their sport after recovery, after a proper recovery?
Yeah, so the vast majority of child and adolescent patients that we see that have sustained sport and non-sport related concussions make an excellent recovery, make a complete recovery, and make a return to their normal school and sport activities. It's a very small proportion of patients that go on to experience persistent symptoms that require additional investigations, consultations, and treatment.
Well, thank you very much for your time today. I know this information is going to help a lot of athletes, coaches, parents, and people just recover in a more appropriate way.
Awesome. Thanks for having me.
Thank you to each of our athletes for their time and participation. We hope this video brought you awareness and understanding about the severity of concussions and how they can affect you as an athlete around both your physical and mental well-being now and in the future. Play safe and have fun.